Good morning and welcome to the Balancing Act Presents Behind the Mystery. Today, we're featuring a chronic autoimmune neuromuscular disease, which can literally be translated to mean grave muscle weakness.
Generalized Myasthenia Gravis, also known as gMG, can have an immense impact on certain activities of daily life. This may include weakness of the muscles that control activities such as talking and chewing, to swallowing and even breathing. So, let's go
Behind the Mystery.
My husband and I, we had both recently retired and really looking forward to a great time. I was extremely active. I walked 4 miles a day, and I loved working on my mosaics. My gMG story began abruptly in February of 2022, when I suddenly began slurring my words and seeing double. It escalated to the point where I was starting having weakness of my facial muscles. These symptoms fluctuated. One moment I was fine, the next I was slurring my words, then it would stop, and then I would have double vision. I decided to look up my symptoms online, and myasthenia gravis came up as a result. I had an appointment with an eye doctor who specialized in double vision. I told him about my research, and he immediately called a friend who was a neurologist to get his input. After he heard what was going on, he was able to quickly get me in for an appointment and even ordered blood tests for me that day. The neurologist explained the results of my blood test and also performed a litany of other tests. It was at this appointment he confirmed what I already suspected. I have anti-AChR antibody positive gMG.
Generalized Myasthenia Gravis, or gMG, is a rare chronic autoimmune disease in which autoantibodies attack specific proteins in the neuromuscular junction, a connection between the end of a nerve and muscle, resulting in muscle weakness. Initial symptoms may include double vision or drooping eyelids, difficulty speaking and chewing, difficulty supporting the neck, difficulty swallowing, choking, difficulty breathing at rest or during physical activity, weakness in arms and legs. It is important to note that not all gMG patients may experience these symptoms. Disease presentation and progression may vary. Certain blood tests can detect elevated levels of antibodies to help identify the condition, such as anti-acetylcholine receptor antibodies, anti-AChR, or anti-muscle specific kinase antibodies, MuSK. Once diagnosed, your healthcare provider will work with you to come up with a management plan. It is important to consider symptom fluctuation as well as the set of symptoms when making treatment decisions, and to recognize the impact of gMG symptoms on a patient's activities of daily living.
Well, I was shocked. Again, I was so healthy and so active. However, I was still overwhelmed trying to come to terms with this diagnosis. I just didn't understand how this could be happening to me.
More Behind the Mystery when we come back. Welcome back to Behind the Mystery of Generalized Myasthenia Gravis.
The neurologist started me on a few treatments and my gMG symptoms did start to improve. I tried to continue my life as I had before my diagnosis, not taking the rest breaks that I really needed. I thought I had it under control, but at the end of the day I had more muscle weakness and I would still continue to slur my words. Honestly, at this point, I was still in the state of denial. I continued my power walks, although decreasing the distance. I thought I had it under control, but I didn't. I continued to face several challenges with my gMG. My husband was by my side through it all, and so were my family and friends. But I'm a fighter, and I fought every single time.
There is no cure for gMG. Treatment goals include reducing muscle weakness and improvements in MG activities of daily living. Prior to 2017, there were the conventional therapies and the surgical option of thymectomy. Physicians now have 5 FDA-approved therapies to offer their patients based on their diagnosis. In recent years, newer treatment strategies that target specific areas of the immune system involved in the pathogenesis of MG have been explored.
It was challenging dealing with the day-to-day ups and downs of living with a chronic illness. I was living a life so different from what I imagined it was going to be. When I found the MGFA, I found it to be very supportive as well as informative. It helped me understand more about my disease, and the more I know about my disease, the more equipped I am to protect myself. I attended a 3-day MGFA virtual conference and was able to connect with other patients, and that was invaluable.
When we come back, the Myasthenia Gravis Foundation of America and Alexion Pharmaceuticals will be in studio for an exclusive interview. Stay with us.
Well, welcome back to the Balancing Act Presents Behind the Mystery of Generalized Myasthenia Gravis.
We're joined by Samantha Masterson, President and CEO of the Myasthenia Gravis Foundation of America, and Wendy Erler, Vice President of Patient Experience and Advocacy at Alexion AstraZeneca Rare Disease.
Welcome, ladies. Thank you so much for being here today.
Thank you.
Thank you for having us.
Samantha, tell us a little bit more about MGFA.
MGFA is the leading patient advocacy organization in the MG space. We're the only national patient organization that solely focuses on myasthenia gravis. We were established in 1952. Our mission is to create connections, enhance lives, improve care, and cure MG. And our vision is a world without MG. And I love that our mission starts with create connections, because that probably is the single most important thing that we can do for community members, certainly the newly diagnosed, is to help them meet others who are on a similar journey and understand the diagnosis.
Tell us how you maintain a connection with the growing community.
We host a national annual patient conference, which is the largest gathering of MG community members. It's for patients, but also for their caregivers, because that's an entirely different population that needs a lot of care and attention and information. We also have community health fairs that we host around the country. You get education and information, but you also can make those very important connections with other folks that are diagnosed and living a similar journey. We're bringing the MG Walks back.
Oh, that's great.
We haven't hosted the MG Walks since pre-COVID. This year we're going out with 3 walks in Boston, New York, and Tampa. So that's really exciting.
Okay, Wendy, why don't you tell us about Alexion's work with the MG community?
Well, our work begins and stops in myasthenia gravis with the community and with MGFA, and we're so lucky to have the partnership and collaboration with the events that Sam was able to highlight. That's really a chance for us to listen and learn from across the entire community about their actual lived experience, and then what do they need? What is of utmost importance to patients and caregivers? MGFA also leads a scientific registry, which enables us to understand what is the natural history of the disease along with the real world experience. And so that's another really important contribution to science.
Samantha, tell us a little bit about the relationship you have with your industry partners.
I think it's fair to say that key stakeholders now understand that we are stronger together. So we have 2 brand new strategic initiatives which Alexion is supporting. We launched the MGFA helpline because we identified a gap. We are receiving this sheer amount of calls to our general line of patients and caregivers or family members who just needed somebody to speak with. And we weren't equipped to handle those calls on the front lines. So we identified this as a gap. The second initiative is translations. We're translating in 5 languages across the entire myasthenia.org website, as well as our MGFA online community.
We think that's so important for health equity, and particularly when people are trying to connect in their native language becomes even more critical when you're talking about healthcare diagnosis and potentially the way that you're being treated. So this is a really critical initiative.
Wendy, what else can be done to help support and engage the community?
One of the other things that MGFA leads is a clinical scientific congress, which really brings experts in the field who are focused on generalized myasthenia gravis into a forum to share research, learnings, scientific discoveries, and patients and caregivers are also able to be in attendance at that forum.
That's great.
Thank you, ladies, so much for being here today and being a part of the show, and really for providing the information that you provided.
Thank you.
Thank you.
All right, when we come back, more with Jan and Dr. Silvestri. Stay with us.
For people who feel limited by the unpredictability of generalized myasthenia gravis and who are anti-AChR antibody positive, season to season, ULTOMIRIS is continuous symptom control with improvement in activities of daily living. It is reduced muscle weakness. And ULTOMIRIS is the only long-acting gMG treatment with the freedom of just 6 to 7 infusions per year. For a predictable routine I can count on.
ULTOMIRIS can lower your immune system's ability to fight infections, increasing your chance of serious meningococcal infections, which may become life-threatening or fatal, and other types of infections. Complete or update your meningococcal vaccines at least 2 weeks before starting ULTOMIRIS. If ULTOMIRIS is urgent, you should also receive antibiotics with your vaccines. Before starting ULTOMIRIS, tell your doctor about all of your medical conditions and medications. ULTOMIRIS can cause reactions such as back pain, tiredness, dizziness, limb discomfort, or bad taste. ULTOMIRIS is moving forward with continuous symptom control. Ask your neurologist about starting ULTOMIRIS.
Welcome back. Let's hear from Dr. Silvestri about an FDA-approved treatment option for adults with generalized myasthenia gravis.
ULTOMIRIS is a prescription medicine used to treat adults with generalized myasthenia gravis who are anti-acetylcholine receptor antibody positive. It is not known if ULTOMIRIS is safe and effective for the treatment of gMG in children.
ULTOMIRIS ravulizumab CWVZ is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. ULTOMIRIS increases your chance of getting serious meningococcal infections that may quickly become life-threatening or cause death if not recognized and treated early. Please see additional important safety information throughout this video and visit ultomiris.com/gmg for the full prescribing information and medication guide for ULTOMIRIS, including boxed warning regarding serious meningococcal infections.
ULTOMIRIS is the only long-acting gMG treatment that offers the freedom of just 6 to 7 infusions per year, with 8 weeks between each infusion starting 2 weeks after an initial dose. ULTOMIRIS targets and blocks a protein called C5, a part of the complement system, though the exact way ULTOMIRIS works as a treatment for gMG is unknown. Even though complement plays a role in damaging your muscle cells in gMG, it's also part of the body's immune system, which helps protect against infection. This means that blocking it could mean a higher risk of certain infections. ULTOMIRIS was studied in a 26-week clinical trial that included adults with varying degrees of severity of anti-AChR antibody positive gMG. The trial measured the impact of ULTOMIRIS using the MG-ADL and QMG scales. At week 26 of the study, the ULTOMIRIS average improvement in MG-ADL total score from baseline was 3.1 versus placebo 1.4. At week 26 of the study, the ULTOMIRIS average improvement in the QMG total score from baseline was 2.8 versus placebo 0.8. Have an open dialogue with your physician about your symptoms, treatment, and how they're impacting your MG-ADL. Connect with advocacy groups to find a community of support. Be your own advocate and get the care and treatment you need.
While I saw some symptom improvement, I wanted to understand my other treatment options. In my discussions with my neurologist, we talked about starting infusions of ULTOMIRIS. He explained to me that ULTOMIRIS is a complement inhibitor indicated for the treatment of adult patients with gMG who are anti-AChR antibody positive, which I was aware that's what I was. The doctor and I discussed the benefits and risk of treatment, including that I would need meningococcal vaccinations at least 2 weeks before my first dose of ULTOMIRIS due to the risk of serious meningococcal infections. We further talked about the most common side effects, which are diarrhea and upper respiratory infections. We decided ULTOMIRIS would be a good fit for me. After starting ULTOMIRIS, over time I noticed some improvement in my gMG symptoms, like it's less difficult getting out of my chair, my double vision has lessened, and my breathing's improved. Slowly, my muscle weakness has improved. And while I'm not going out there walking 4 miles a day like I used to before diagnosis, I am getting out there and getting short walks in whenever I can. I still have muscle weakness, but I see ULTOMIRIS as a long-term treatment to help manage my gMG symptoms. This is my experience, and yours may be different, and some people may not respond to therapy. 2 weeks after the initial loading dose, I only have to get my infusions once every 8 weeks, so it easily fits into my routine. After each administration, I'm usually monitored for at least an hour for infusion-related reactions. My experience has taught me to never give up. Accept that your life is different. Don't dwell on what you can't do, but rejoice in all the things you can do. Celebrate those victories. Have an honest, open relationship with your doctor. Be sure to document your symptoms and speak up when you know something's wrong. Advocate for yourself and ask for testing to be done. gMG doesn't define me, but it certainly did redefine me. I learned to appreciate the little things. I learned that the outpouring of love and prayer is invaluable.
Thank you for watching The Balancing Act Presents Behind the Mystery of Generalized Myasthenia Gravis.
Speak to your doctor and visit automiris.com/GMG. You can also visit our website, thebalancingact.com.
And stay tuned for the full important safety information, including boxed warning.
Important safety information. What is the most important information I should know about ULTOMIRIS? ULTOMIRIS is a medicine that affects your immune system and may lower the ability of your immune system to fight infections. ULTOMIRIS increases your chance of getting serious meningococcal infections that may quickly become life-threatening or cause death if not recognized and treated early. 1. You must complete or update meningococcal vaccines at least 2 weeks before your first dose of ULTOMIRIS. 2. If you have not completed your meningococcal vaccines and ULTOMIRIS must be started right away, you should receive the required vaccines as soon as possible. 3. If you have not been vaccinated and ULTOMIRIS must be started right away, you should also receive antibiotics for as long as your healthcare provider tells you. 4. If you had a meningococcal vaccine in the past, you might need additional vaccines before starting ULTOMIRIS. Your healthcare provider will decide if you need additional meningococcal vaccines. 5. Meningococcal vaccines do not prevent all meningococcal infections. Call your healthcare provider or get emergency medical care right away if you get any of these signs and symptoms of a meningococcal infection: fever with high heart rate, headache and fever, confusion, muscle aches with flu-like symptoms, fever and a rash, headache with nausea or vomiting, headache with a stiff neck or stiff back, or eyes sensitive to light. Your healthcare provider will give you a patient safety card about the risk of serious meningococcal infection. Carry it with you at all times during treatment and for 8 months after your last ULTOMIRIS dose. Your risk of meningococcal infection may continue for several months after your last dose of ULTOMIRIS. It is important to show this card to any healthcare provider who treats you. This will help them diagnose and treat you quickly. ULTOMIRIS is only available through a program called the ULTOMIRIS and Soliris Risk Evaluation and Mitigation Strategy, REMS. Before you can receive ULTOMIRIS, your healthcare provider must enroll in the REMS program, counsel you about the risk of serious meningococcal infections, give you information about the signs and symptoms of serious meningococcal infection, make sure that you are vaccinated against serious infections caused by meningococcal bacteria, and that you receive antibiotics if you need to start ULTOMIRIS right away and are not up to date on your vaccines, give you a patient safety card about your risk of meningococcal infection. ULTOMIRIS may also increase the risk of other types of serious infections, including Streptococcus pneumoniae, Haemophilus influenzae, and Neisseria gonorrhoeae. Certain people may be at risk of serious infections with gonorrhea. Who should not receive ULTOMIRIS? Do not receive ULTOMIRIS if you have a serious meningococcal infection when you are starting ULTOMIRIS. Before you receive ULTOMIRIS, tell your healthcare provider about all of your medical conditions, including if you have an infection or fever, are pregnant or plan to become pregnant, and are breastfeeding or plan to breastfeed. It is not known if ULTOMIRIS will harm your unborn baby or if it passes into your breast milk. You should not breastfeed during treatment and for 8 months after your final dose of ULTOMIRIS. Tell your healthcare provider about all the vaccines you receive and medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements, which could affect your treatment. What are the possible side effects of ULTOMIRIS? ULTOMIRIS can cause serious side effects, including infusion-related reactions. Symptoms of an infusion-related reaction with ULTOMIRIS may include lower back pain, abdominal pain, muscle spasms, changes in blood pressure, tiredness, feeling faint, shaking, chills, rigors, discomfort in your arms or legs, bad taste, or drowsiness. Stop treatment of ULTOMIRIS and tell your healthcare provider right away if you develop these symptoms or any other symptoms during your ULTOMIRIS infusion that may mean you are having a serious infusion-related reaction, including chest pain, trouble breathing or shortness of breath, swelling of your face, tongue, or throat, and feel faint or pass out. The most common side effects of ULTOMIRIS in people with gMG are diarrhea and upper respiratory tract infections. Tell your healthcare provider about any side effect that bothers you or that does not go away. These are not all the possible side effects of ULTOMIRIS. For more information, ask your healthcare provider or pharmacist. Call your healthcare provider right away if you miss an ULTOMIRIS infusion or for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. Please see the full prescribing information and medication guide for ULTOMIRIS, including boxed warning regarding serious meningococcal infections at automiris.com.